Welcome to Trauma Assessment 101. Today we're going to go over briefly the A, B, C, D, E, F, G, H, and I of trauma assessment. We will start with ABC. Just like in all nursing interventions and all crisis and emergency, including CPR, ABC always comes first. Remember that for your NCLEX. A is always airway. For airway, we want to do a brief inspection of the mouth as well as place oxygen on the patient. We want to ensure that there's no obstructions and that the patient has breath sounds. The next thing is breathing. The thing you're looking at for breathing is chest rise. You must expose the patient. If he is wearing a shirt, cut it off. If he has a gown on, take it off. You want to make sure there's equal chest rise. You also want to listen to his breath sounds. Now in airway, you're just feeling for air coming out of the mouth or nose. In breathing, you want to listen to his actual breath sounds with a stethoscope. Notice that was very quick. What you're looking for is equal breath sounds, equal chest rise, and to make sure that there is air moving in and out. The next thing is circulation. With circulation, it's essential that you look at his color. If he's pale, he may have lost a lot of blood. If he is warm, pink, and dry, he has good perfusion for the moment. You should also check pulses. Pulses are in the femoral area as well as the radial area. Both should be checked, as one is central circulation and one is peripheral circulation. The radial pulse may be weaker. That may mean that he is not pumping blood out to his periphery. The next thing is demeanor, which is D. In demeanor, you want to ask the patient questions. Does he know where he is? Can he speak to you? Is he alert and oriented is basically what you're trying to get at. And we can do that by shaking the patient and talking to him and looking directly in his eyes. Here, you're going to find out what his GCS, his Glasgow Coma Scale, is. If it's less than 8, you want to intubate. If it's less than 15, he's slightly confused. You want to find out and rule that he doesn't have a head injury. The next letter is E. For E is expose, and really do expose him. Take all his clothes off from head to toe. If he's wearing clothes, cut them off with your trauma shears. You want to do a basic quick assessment of any injuries that you notice: bleeding, cuts, broken bones, pain, anything like that. Also during this, you can also do quick palpations on the ribs to find out if he has any broken ribs or pain. Press on his stomach for any distension or pain there. Look at his extremities to find out any broken bones, lacerations. It's essential that you quickly and thoroughly look through any and all parts of his body to make sure that you notice any abnormalities. The next is F. F stands for 5 interventions and focused assessment. 5 interventions are Foley, fluids, IV, monitor, and consider intubation. Foleys are mostly seen in pelvic injuries or patients with severe head injuries that are intubated, as well as massive lower extremity fractures. IVs are for every patient. They should be large bore, 18 to 16 to 14. Those are your large bore IVs. They should be placed, and you should have 2 of them in the antecubital area of the patient. You should also consider central lines for patients with poor IV access. You should also place the patient on a monitor. A quick pneumatic to remember this is white on right, smoke, which is black, over fire, for the 3-lead system. For a 5-lead system, just remember brown dirt on the bottom and grass always grows in the dirt. That's green in the middle. Now that we have that, we can see the patient's vital signs up on the monitor. You should also, during this time, take a blood pressure, a manual blood pressure of the patient. Manual blood pressures are more accurate and are quicker, and they are essential and the most essential vital sign for the patient. The next thing you're going to look at is G, which is give comfort. In give comfort, you're going to re-cover the patient with warm blankets. You're also going to assess the patient's pain by asking him what his pain level is, and you're going to medicate him appropriately using morphine, Demerol, or Dilaudid. or any other prescribed medication, analgesic. Once the patient is comfortable, you move on to H. H is health history. Here you're going to do a focused history, asking the patient what his health history is, what his allergies are, where he was, what the accident was, and if he has any family members that you should call. This will provide you information for your future interventions. The last thing is I. I is inspect the back. Inspecting the back requires 3 people. The first person will hold the patient C-spine still by cupping the arms in your arms, or cupping the patient's head in your arms like this, stabilizing your hands on the shoulder, and this person is in charge of the count to roll the patient. You'll have another person at this part of the bed. You will grab the arm and bring it across the patient, put one hand on his hip, one hand on his shoulder, and on the count of the person stabilizing the neck, roll the patient. At this time, the person on the other side, your third person, will palpate the back and ask the patient if he feels any pain. You'll also notice for step-offs or any abnormal findings on the back, including lacerations, gunshot wounds, stab wounds, or any other abnormality. The patient should remain on oxygen throughout the trauma assessment. And just of note, all these interventions are happening at the same time, as well as blood draws, which happens in circulation. And from there, once you gather your data, from there you'll decide what your next interventions are. That's a basic trauma assessment in under 10 minutes. Thank you for your time.